Hello everyone, my name is Rex Chisholm and I'm Director of the Center for Genetic Medicine here at Northwestern University. And I am delighted to have all of you that are here attending in person, and I'm also delighted to be able to welcome all of you that are attending us virtually over the internet. This is an experiment for us, but an exciting one, and we're glad to have you all here. This is really a terrific opportunity and a terrific time for all of us that are interested in the area of genetics and genomics and all of the omics and how they might actually contribute to improved healthcare. After all, that's why institutions like the Feinberg School of Medicine exist, is to maximize our educational activities and our research activities to improve healthcare for the people that live in our city and throughout the nation. And we think the excitement that came out of the human genome sequence and the completion was just the beginning. The next step is to actually begin to think about how to use the fruits of that knowledge and convert that into meaningful results for the population. And so today's event is to try to, in our small way, get us involved and engaged in that discussion. And we think today we've got an excellent group of panelists, and I think we'll have an exciting time. This is really meant, as you'll hear later, to be an interactive event, so we're looking for you to all be able to participate as well. So on behalf of Northwestern University and the Feinberg School of Medicine, Center for Genetic Medicine, we thank you all for coming. We thank those of you on the internet for listening in, and we look forward to a really great session. So this has actually been a very exciting partnership between Northwestern and Affymetrix. That's a name that's well known to those of you that are involved and engaged in the area of genomics. And so it's my pleasure now to turn the podium over to Robert Wells from Affymetrix.
Thank you very, very much, Rex, and thanks to all of you who are out here on a blustery Chicago morning and those who are with us on the web. Several years ago, Affymetrix started began a strong interest in the intersection of the world of research and innovation and discovery with the world of public policy. And since that time, since 2001, we have sponsored a number of these genetic age symposia. We kicked off in San Francisco, then we've had 2 programs in Washington, D.C., 1 program in London, and now here in Chicago at this terrific facility at Northwestern. And that's really because we think that this world of public policy, as it tries to enhance genetic discovery and tries to see the applications go from the bench to the patient bedside, is one that poses a number of intriguing, fascinating, and really quite profound public policy questions, and you'll hear those discussed here today. It's a discussion that we think, I have to say, having been part of this for 5 years, inevitably raises more questions than it answers. And that's why we think the dialogue is so important, and why I encourage all of you here in the audience to view this not as a lecture program, but as a 2-way discussion program, or 3-way discussion, or multi-part discussion program that will, I hope, if nothing else, allow you to leave here today thinking about this genetic age in which we now live, and both the opportunities and the challenges that it poses for all of us. Before we dive into the program, I just want to again express my thanks to Rex and to all of the team here at Northwestern. We've been working with them for about 6 months now and putting the program together, and it has been a wonderful collaboration, and really I commend them for their forward thinking and for their dedication to seeing this program go forward today. Let me now turn the program over to my colleague, Robert Mittman, who will moderate the discussion today. And let me once again say thanks to all of you for being part of it. It's a pleasure to be here. Robert?
Thanks, Robert. I'd like to add my welcome to Rex's and Robert's. I will be moderating today, and Robert said that this was going to be two-way, three-way, multi-way, and that really is my responsibility to make sure that the multi happens. What I'd like to do before we get started is just lay out a little bit of what to anticipate today. We're going to start with an opening keynote address from Dora Hughes. Dora is the legislative assistant in charge of health policy to Senator Barack Obama, and we're delighted to have her here. Following Dora's remarks, we'll have a chance for a brief question and answer period, and then move on to the panels. And we have 3 panels planned. The first panel, which is entitled The Path to Personalized Medicine, really we intend to serve 2 purposes. One is just definitional, to lay out a little bit, well, what do we mean by personalized medicine? How does it compare to genomic medicine or other various omic or etic medicines? Just to get a sense of what is it that we're talking about. The second is to address some of the scientific and research issues in the area with that first panel. The second panel is entitled Creating the Climate for Personalized Medicine, and that's really focusing on the economic and policy environment for personalized medicine, trying to understand better what are the conditions that will advance or impede the development and application of personalized medicine. The final panel, called Let's Get Personal, the Individual and Personalized Medicine, the title actually says it all. Really, it's bringing it back home to the individual. What does it mean to patients, to citizens, to have a shift towards personalized medicine? What does it mean for their access to health services, to health insurance, and other goods in society? The way that we'll proceed on the panels is highly interactive. I'll begin with just some conversation with the panelists. I will very quickly ask you, though, the audience, to come in with your comments and questions. So I'm putting you on notice now to be ready. So with no further ado, let me introduce Dora Hughes. And Dora, I welcome your comments. Thanks very much.
Good morning. I want to start by also adding my thanks to Affymetrix and Northwestern for inviting me to participate in the symposium this morning. Obviously, this summit is particularly well suited given the changing political environment, emerging policy issues, and frankly, the very rapid scientific advancements that are already translating into tests and treatments for millions of Americans. I myself am quite looking forward to hearing the next 3 panels and learning more about this issue. It's very rare that I can sneak away from Washington to spend half a day on an area of substantive interest of mine. And so, although my office has already asked exactly what time I plan to be back in DC, I plan to fudge and stay as long as possible. For the next 10 minutes or so, I'm going to focus my remarks on the politics and policies that will affect genomic legislation on the Hill, particularly in the Senate. And of course, I will spend a few of those minutes shamelessly promoting Senator Obama's Genomics and Personalized Medicine Act. And then I will finish with a few words about what we desperately need from all of you to ensure that the issues of genomics continue to be a priority in the 110th Congress. So to begin with the politics, and obviously all of you know that I am a Democrat, so all of my comments from this point forward will be quite biased. And I will also say as a caveat, I also worked for Senator Kennedy, so I'm a little bit left of center. But today, representing Senator Obama's office, he is clearly not of the same ilk as Senator Kennedy, so I will be a little bit more centrist than I might otherwise be inclined. But obviously, all of you know the outcomes of the November elections, and although most of the votes that were cast against the Republicans were because of concerns about the war or corruption or egregious behaviors and at least one racial slur. I think that there was also a good bit of restlessness among the average American about the status quo in the nation. And consistently, health and healthcare issues have ranked among the top domestic priorities for America. And given that we do have a greater number of Democratic officials in the Congress, I expect that there will be considerably increased attention and, more importantly, action on health and healthcare in the 110th Congress. In the House, the main health committees are the Energy and Commerce Committee and the Ways and Means Committee. And certainly, given the way their rules, their structure, we will see a large number of bills fly through the House. On the Senate, we have a very slim one-vote majority, and so we will not be able to pass the same number of bills or the same types of bills as the House. However, given that we do have the majority, we will be able to conduct a number of hearings and oversight investigations, and so that will help to ensure that there will be still an increased level of activity in the Senate, even in the absence of passing bills and so forth. Much work needs to be done, and much work will get done in the Senate and the House. That much is for certain. What is uncertain are the details about the committee structure and the subcommittee structures. We are just now strategizing about the health agenda as well for the 110th Congress. What we do know is that in the first 100 days, if you're on the House side, or in the first several months on the Senate, the first bills that will go through with regards to health will focus largely on the more partisan or more controversial issues. The stem cell bill is a good example of what we can expect. We can expect drug importation, drug negotiation to also receive quite a bit of attention on the floor and in the first few days. Once you get past the high-profile media type bills, we do expect the committee to tackle some of the more bread-and-butter issues. Drug safety is a good example. Food safety is a bit newer, but obviously, given what happened with the spinach contamination and more recently Taco Bell in New Jersey, that's another increasingly higher-profile bill that will be looked at. If Ryan White and bioterrorism don't pass this week, we can expect those to receive top billing in the new Congress as well. And then even aside from the specific bills, there's a number of large programs and agencies that are overdue for authorization. The NIH chairman, the former chairman Barton on the House side, had an NIH reauthorization bill that the Senate will likely take up next year. ARC is due for reauthorization. And some of the workforce bills, Title VII, Title VIII, for example, are also overdue, if you will, for reauthorization. So it's a lot of work to be done, and we'll have a better sense of in which order that these bills and reauthorizations will be undertaken, probably in the next month or so. The other thing is that the Republicans have not finalized their list of who will be on the health committees. One potentially interesting addition to the Health Committee in the Senate would be Dr. Coburn. For better or for worse, when people work with him, he's actually a very effective champion for a number of health issues. So in the sense that we have someone who's still very clinically trained and oriented on committee, which people can vary in their opinions on that. But we have worked closely with Senator Coburn on a number of issues and expect a continued partnership next year. And I should mention the new HELP members on the Democratic side, besides Senator Obama, will be Senator Sherrod Brown and Senator Bernie Sanders. So moving on a little bit to focus specifically on genomics, I would say there's three top pieces of legislation that directly relate to genomics that I expect to see debated next year. The first is GINA. Obviously, it passed 98-0 in the last Congress. It was held up for no really good reason in the House side, but I expect that that will be voted on early and will pass the House and Senate and signed into law. And I think that's good in the sense that it sets a threshold of a foundation for the privacy protections, non-discrimination, and so forth to really make a number of stakeholders more comfortable as we move more into this area. The second bill, or a bill that has not yet been introduced but likely will possibly as early this week, is Senator Kennedy's bill that would regulate laboratory-developed tests. And the third, frankly, is Senator Obama's Genomics and Personalized Medicine Act. And this is the point where, obviously, I shamelessly start to promote Senator Obama's bill. But I want to start, people often ask, well, how in the world does Senator Obama get interested in genomics anyhow? And if you ask him, he might be a little hazy and say, well, she brought it to me. And that's partially true, but not completely. Senator Obama is extraordinarily well-read, and newer issues in particular always pique his interest. And so he had read a number of articles in the New York Times and other major newspapers that have focused on different issues relating to genomics, focusing both on the potential as well as some of the pitfalls. And he spontaneously mentioned it in several of our conversations about a year ago, maybe a year and a half ago at this point. And in my ongoing quest to keep up with him in his reading and to also make sure that I always know a little bit more about what's going on in health on the Hill than he does, I quickly explored the genomics area in depth and realized that despite all the activity going on in the agencies and perhaps even more so in the private sector, that this was an area that had not really been addressed at all by the Congress and the Senate and the House. Now, some people say that might be a good thing. Others would argue that it was an area that was ripe for greater attention and action. And we decided that our office would get involved. It was an area that interests a variety of different staff members in the office and on all levels of leadership in the office. And in August of this past year, we introduced the Genomics and Personalized Medicine Act. This bill has 6 main areas. It has some more, quite a few areas, frankly, but the 6 main areas I'll mention, and in no particular order. The first focuses on efforts to increase agency collaboration, coordination, to make sure they're talking to each other and their efforts are integrated and ideally able to leverage the resources for each of the agencies. The second area focuses on workforce. As all of you in here know, there's a dearth of qualified geneticists, genomicists, and given what's the momentum of this area, we desperately need more with content expertise in these areas. In addition, a number of folks brought to my attention that providers who have no background experience or training in genetics or genomics will likely be the ones who are increasingly offering these tests to their patients and attempting to counsel them about what it means and what the treatments and so forth. And so we needed to make a greater effort to integrate genetics education, training, and so forth into CME, continuing nurse education units, and so forth. The bill tries to expand and build upon the good work that's already going on at the CDC in the area of public health and their family history initiative, for example, or the EGAP initiative. Research, obviously, is a major focus. We're trying to accelerate some of the work being supported in part by the NIH, particularly with focus on biobanking. And I was particularly just cheered to hear about the biobanking work being done right here in Northwestern, as well as translational research to see if we could speed up the translation of the research findings into actual tests and treatments for patients. And the final 2 areas focus on regulation of tests, and the last is financial incentives. So the first, just to go through a number of the questions and comments that we received, perhaps the first is people say, why is the bill so broad? Or why is it so comprehensive? And I was always a bit amused because when I made an effort to streamline the bill or to ask the experts, stakeholders who were reviewing the bill for me, which areas should be cut. There is no agreement. Some thought Section 1 just had to go, and others thought Section 1 was the most important, and so it just became impossible to really decide what should the priorities be for the bill. And so for the purposes of the first introduction, I left it purposely broad and comprehensive. I will say when we reintroduce it, I have a much better sense now in terms of what the priorities of Senator Obama are and on the outside. So it will be definitely a streamlined version. The second question is which areas are controversial, or which controversial being a PC term for which areas do people oppose or just outright hate. And I have to say the first is obviously that the regulation makes a number of groups a bit squeamish. People all over the map with regards to regulation. Some of those who have to go through the FDA process now say that the playing field is not level. Others in the advocacy groups point out that the CLIA doesn't adequately ensure a high quality test, or there's not enough information available to the public and providers of the tests. Those who offer laboratory developed tests have been quite clear that additional regulation could pose an onerous burden onto their work, and could also become a barrier to innovation and early marketing of some of the newer tests and treatments. I generally think that in this regard, everyone's right, everyone's a little bit wrong, and somewhere in the middle is the truth. And we hope to strike the right balance, both in our bill and perhaps even more importantly in Senator Kinney's bill, which is taking an even broader look at the laboratory developed test issue. The second area of controversy is the incentive section. I think this one's a little bit easier in the sense that everyone agrees that there should be an incentive section. Everyone on the outside, that is. On the inside, some are, think that there's no need for incentives. Let the market do its thing. But in any case, most of the controversy has been whether the incentive should be in the form of extension of patent protections or market exclusivities. Should there be a tax credit or deduction for research and development? There are ferocious players on each side, and although I'm generally very good at predicting the outcomes of negotiation, in this case, I'm not clear which side, which camp is actually going to prevail. And the final question I get is, what are the chances of genomic legislation actually passing the Senate and hopefully the Congress next year? And frankly, I think the chances are pretty good. I mean, it definitely helped just the shake-up in the committees. I would also say that GINA, although it doesn't address many of the issues that Senator Obama and other bills address, it still has helped to elevate the awareness and engaged folks on this issue. I'd also like to point out that in addition to Senator Kinney's efforts, Senator Smith, for example, held a hearing in July, focused on nutrigenetic testing and exploitation of potential exploitation of consumers, and Senator Snowe obviously is very much interested in continuing to work forward. So I think even in the Senate with the 51 majority, there still is strong interest on both sides of the aisle, strong stakeholders and champions and folks who have already committed to working together. And I thought it very interesting. Yesterday when I was at work, although I don't often like to admit that I was at work on Sunday afternoon, but I ran into a Republican staffer who pulled me aside and said, I really want to hear more about your genomics bill. And so again, I just see all signs as pointing north on this issue. And then frankly, even aside from the stakeholders who obviously have a direct stake in the issue, if you will, it's a number of groups have been quite engaged and willing to help shape and push the legislation. And of all of this, perhaps the most refreshing have been the patient advocacy groups, those who are by no means genomic experts or researchers or practitioners, but are the actual patients or the family and the friends of patients who are already seeing the promise of genomics, and as it will help to create new tools for tests or treatments and ideally cures for whatever diseases or cancers or other debilitating conditions. And I particularly like the number of groups that have, the newer groups that have the name Cures in their title, like Cure Alzheimer's as opposed to the Alzheimer's Foundation or Faster Cures. Patients have high expectations for genomics, and I expect that we will be able to meet them in the not so distant future. So to conclude, my ask to all of you, the first ask is very practical. Again, Senator Obama is going to reintroduce the bill. It will be bipartisan. It will be rewritten so it goes to Health Committee. It will be streamlined, and it will be a priority of our office. And I particularly like to emphasize that last point. I received one call actually just Wednesday of last week by one organization said, now, does he really intend to do much with this next year? Is he even going to reintroduce it? I was like, unequivocally, the answer is yes. And so to the extent that you could review the bill with a fresh eye for those who have already asked for assistance or somewhat harassed, I'm looking at Kathy Hudson as I say harassed, for assistance on the bill, or those who have other feedback, feel free to email me preferably or call me and we can discuss changes for any modifications. That would be most welcome. But the second, I think, is particularly for this audience, many of you represent organizations and institutions for which advocacy is not part of the core function or the mission. You represent academic medical centers and researchers, some provider groups that may or may not lobby, practitioners, and so forth. But each of you have a unique message to bring, and collectively, it's a much more powerful message for those of us who are trying to push legislation on the Hill. Genomic health bills and even genomic provisions in other health bills can have a tremendous impact on the programs, the funding allocations, the rules and regulations of the federal agencies, and all of us would greatly benefit from congressional involvement. So I would ask that you weigh in, let your voices be heard. Genomics is already revolutionizing the practice of medicine. We need to keep up the momentum and push harder, push smarter to achieve its full potential. I look forward to partnering with all of you in this regard in 2007, and I will end now and just say I am open for a few questions if we have time.
Thank you very much. We do indeed have time for a couple of questions. I believe we have some mic runners. Mic runners, can you identify yourselves? There's one right there. Any questions? Yes, right down here in the front.
I'm afraid I'm a little cynical, but how do you work with your peers, the legislators, who are horribly scientifically illiterate in explaining a bill of this type? I mean, to me, this seems like I've been in this situation. I've worked on the state level, and it was a disaster. I mean, their attitude was usually, I don't understand it, therefore I don't care. How do you do that? How do you approach it?
Right. No, you raise a valid point. I was one of those who was functionally illiterate in genomics and genetics when I started, and I'm an internist by background, so I pulled out my medical school textbooks to remind myself, now how exactly do you define a gene? And certainly the other codones and things like that had long slipped my mind. But that's part and parcel of what we do on the Hill. 98% of the health staff will know nothing about this area, but we often don't know enough about many areas that we eventually get involved in. So it's not unusual. B, I think that health staffers, particularly the good ones, are quite savvy about reaching out to trusted advocates and stakeholders on the outside to hear their opinions of the bill. And in that sense, that's why it's particularly important to me to make sure that the provisions of the bill are on target and timely and are truly a priority, so that when you weigh in with staff on the Hill, you can reassure them or advise them on how they should look at the bill. The other thing that's very helpful in this sense is this whole area is getting a lot greater attention in the media. And even if you don't have a scientific background per se, many staff still read the New York Times or the Tribune or the Washington Post, and this type of articles is ginning up interest on every level, and so I think that helps to have staff more inclined to take a serious look at it. And then some of that's frankly a challenge for the office. And so whether it's dear colleagues, I hope to have a briefing early next year, just say, basics 101, what is genomics, and have a number of different groups present and instruct. And so I'm not as concerned about the lack of content expertise on the Hill for this issue. For others, certainly it's more troubling. And the last thing I would add is truly, I'm hearing from people that I don't normally hear from on bills. And disease-specific groups in particular have varying levels of clout on the Hill. But if you have like I mentioned, the Alzheimer's Association coming in, many of the different cancer advocacy, and there's about 200 different cancer advocacy groups, if they're on target and on message and still saying genomics is important, genomics is important, genomics is important, and we all like this bill, that too will help immensely.
Any further questions? Yes, right there.
Can we hold on for a microphone? Because this is going out on the webcast, they won't be able to hear you.
Because your specialized skills in medicine and legislative advocacy, I'm wondering, in your conversations with Senator Obama, do you have an inclination on how this is going to be for those who maybe are not having access to health care? This is a wonderful opportunity to improve medicine, but the thought is that many of these drugs are very costly, and we still have major problems in our delivery system in terms of public health. So I'd be curious what the dialogue has been between you and the senator on health access.
If you ask Senator Obama about his top 3 priorities, he will say the first is expansion of health insurance coverage, the second is cost containment, and the third is quality of care. And he lumps prevention into quality of care, which is fair depending on how you look at it. So I think that he understands certainly the importance of access and how genomics ties in. I also think that he agrees with many who could see this as a tool for cost containment. Certainly the tests are very expensive, but long term, if we have a better sense of what will work for which person at which time, that could help to address some of the cost issues. And certainly in terms of quality of care, this is already, in many cases, becoming a central component to quality of care. So certainly Senator Obama tends to look at all issues at the 30,000 square foot level and trying to see how the moving parts, how they intersect, how they relate. And I think that he would satisfy, if you had a conversation with him about this, I think that he would satisfy your concerns. But certainly access is probably his top priority at this point, and we're very careful about just general access, but in this area to make sure that underserved low-income populations too will benefit for genomic tests and treatments, just as the insured population or more affluent population.
We have time just for one more question, right here on the...
Good morning. I'll hold the Washington questions for later. But the Senate has passed a genetic non-discrimination bill for about 8 years now, or 8 Congresses. As we look at personalized health and move genetic information into the personal record of the patient or the practitioner's record of the patient, are we prepared to write a bill that essentially calls for non-discrimination in the use of any healthcare information as opposed to just genetic?
That issue is receiving greater attention as well, particularly in the efforts to pass the health IT legislation. And a number of groups separately have looked at health IT broadly, but particularly electronic medical record and the current protections, if you will, which most would say are inadequate, as to how can we strengthen these provisions. And in some ways, some argue that it's fortunate that the health IT legislation was never able to pass the House and the Senate. They did not agree in the conference. And so we may have the opportunity to beef up those protections. And the next health IT bill, obviously in our bill we included a provision that was basically a sense of the Senate, mostly because we did not want to duplicate any of the provisions that are already in GINA with regards to some of the concerns you mentioned. But that is a roundabout, rambling way, admittedly, of saying that we need to do much more both legislatively but also through rules and regulations in this area. And I think that the majority of staff would agree with your concerns, and that the current level of activity is inadequate.
Dora, thank you. Thank you so much for your comments, for staying to answer some questions. And please join me in thanking Dora Hughes.